COVID crisis in Sudbury. That's what we're going to be talking about with three very esteemed individuals on your screen right now. You can see Hugh Kruzel, who's representing Canadian Association of Retired Persons, CARP. I'm John Lindsay, and I'm also with CARP and Friendly to Seniors. And Jim Gordon, former mayor of Sudbury and a member of the provincial legislature for many years. And Dr. Peter Zalan. Dr. Zalan practically needs no introduction because we hear Dr. Zalan constantly on the media, in the paper, radio, TV, commenting on various health issues. You were representing the medical community at Health Sciences North for many years, an anesthesiologist on staff at HCN, and now you're retired, but you're still very active and you're very concerned about the COVID crisis that we're facing right here in Sudbury at the present time. You were just recently on CBC, you're in the paper, and you're concerned about what's happening right now, and that's I guess it's the surge and the fact that we're also missing out on vaccines. Is that correct?
That's correct. Do you want me to start first, or?
Yes, you go ahead.
Yes, go ahead, please. Yes.
Okay. And thank you for saying all those kind things. That's what happens when you get retired. You get to do all this other stuff. In any case, so just today, actually, Health Sciences North announced that they've started to cancel some elective surgery and limit outpatient clinics. Not a surprise, as the number of patients with coronavirus in the intensive care unit is now up to 6, the highest number ever. And we also have 3 active outbreaks at the hospital. And ICU has always been important to me since I spent a lot of my time working there in the past. Anyway, the hospital is obviously worried. So also there were 2 relevant announcements today on the news. And one is that the UK variant transmits at twice the rate and as the non-variant, and also is 30 to 50% more likely to put you in hospital. In other words, it spreads more easily and is more deadly. And Dr. Sutcliffe made it official today. Sudbury is in its 3rd wave. We've had the 1st wave, the 2nd wave, and now the 3rd wave. So anyway, a 79-year-old friend wrote to me yesterday, hey, any advice on where I should register for a COVID vaccine? And it was kind of confusing since there's the Ontario place to do that, and also the one locally. So what I said in return is any advice on where I should register. So he wanted to know any advice on where I should register for a COVID vaccine. The answer to his question depends on where you live. COVID-19 vaccination appointments are now available for the York region, which is in the Toronto area, for residents 75 years of age and older. Ditto in Barrie by pre-registering for an appointment through Ontario's new online booking portal, but not so in Sudbury. The following information is from Public Health Sudbury and District's webpage. As of today, I looked it up, and it still says, while those aged 75 and older are not yet being offered the vaccine locally, they will be next in line to receive the vaccine. Currently, pharmacies across the service area are not among those offering the COVID-19 vaccine, and check back for updates soon.
I'm glad you've mentioned that, Peter, because there are Lennox, maybe Addington, Kingston, a number of jurisdictions actually are using, there's 375 pharmacies or so that are actually doing the 60-year-old plus group in those regions. And you're absolutely right. What's the deal? Why are we not included? We're a gray zone. They're not.
Exactly. You're totally correct. That I think that should make a lot of people kind of unhappy and scratch their heads. So anyway, this is, to me, clear evidence that the Northern citizens are not getting a fair deal. The North has, in addition to that, has a higher percentage of seniors than the South. Sudbury and Thunder Bay are in the lockdown, as you said. York and Barrie are not. So pretty odd way of thinking.
We'll be reading your article in tomorrow's Sudbury Star, Because there really is a Monday Sudbury Star.
Yeah, well, some of this was actually in Thursday's Sudbury Star that already appeared. So in Sudbury, businesses are suffering from the second lockdown in 3 months. Our hospitals are at risk of being overwhelmed. Our schools are closed, not the case in the south. And we're reaching 50% levels in variant cases. And just to make you feel more uneasy, in Saskatchewan, it's up to 80%, and in Israel, it's up to 90%. So this is the future. Now, 13 public health units designated hotspots of infection by the province will actually get additional doses on top of their earlier allotment. It's peculiar that of the 13 eligible regions, all 13 are in the south. Only 2 are in lockdown, like you mentioned, and the 2 regions in lockdown in the north, Sudbury and Thunder Bay, are not so designated. It's hard to understand because Thunder Bay actually has been transferring intensive care unit patients all over Ontario due to lack of capacity. I've been told this by our own ICU who's received some of their patients. And Sudbury numbers are rising rapidly. We all need help. And as I mentioned before, we've got more seniors, and that's all of the north. A friend, so leave that aside for the moment. A friend has also been wondering whether he should travel out of the district to get vaccinated, get on a bus with a bunch of friends and go hit the south, get some vaccines in those pharmacies where you can get the AstraZeneca vaccine. So I looked into that as well. So CBC reported this week that some Ottawa area residents were, not this week actually, last week, were traveling to pharmacies in the Kingston area participating, like you mentioned, in a provincial pilot using pharmacies in a rollout. So people from Ottawa are already going to get their vaccines out of, and actually Ottawa is a red zone, Kingston is a green zone. So in other words, we now have people traveling from a red zone to a green zone, encouraged by the government to do so. So think about it. The same province that's refused to grant our request, our mayor's request, community's request for Northern Bubble, has just set up a system that actually encourages individuals to travel out of the district, very possibly taking their asymptomatic infections with them and bringing some new infections back in return. The unintended consequences of bad thinking. So I would say cancel all these special pilot projects in southern pharmacies, apply the same rules for all pharmacies wherever they are in Ontario, reallocate extra vaccines to the north because of the increased percentage of older individuals and the 2 hotspots in Sudbury and Thunder Bay. And the vaccines belong to everyone. And Dr. Sutcliffe, I didn't mention this, but I should, please allocate vaccines to both family doctors and paramedics. Family doctors don't need pilot projects. They've been doing it for a long time. And that's my report.
And actually, the pharmacy's been doing it for quite some time too,
That's
as well.
right.
I know when I phoned in just last week, because I'm over 80, I phoned in and the nice lady on the other end of the line said, well, probably we'll get to you in 2 or 3 weeks. Is that realistic, Dr. Zalan?
Who knows? Like what's clear to everyone is we don't have enough vaccines in Canada. We can't do anything about getting more vaccines. That's not up to the province. That's up to the federal government. But we can do about the fair allocation of vaccines.
Right. Well, looking at it from a political point of view, and Jim Gordon, who's been in politics for many years, and Queen's Park for I don't know how many years, is this a political? Is this something political, Jim?
Well, you know, the general quit. He said he'd set everything up and then he quit. He quit. When did you ever hear of a general in any war who marshaled all his troops and equipment to the line where the war was going to start and then he quits? So when you have a general who's a quitter, and on top of that, you have a health environment guy, Dr. Williamson, who's the medical officer of health for the province, who, when he was asked, are we in the 3rd wave yet, said, well, you know, you really can't tell till it's over. So there's no leadership coming from Southern Ontario for the north, for Sudbury and or Thunder Bay. We're getting now Thunder Bay's very sick COVID patients at the hospital here in Sudbury because they can't keep up with it. We have as bad a situation now as you could probably see in Thunder Bay. That is, we have the pandemic roaring like a nuclear station that is blowing up and
And yet,
throwing
Jim,
out all these COVID bugs all over the community.
Right.
We need a change
Jim,
in
aren't we-
policy. We need a change in policy, and we need vaccines sent up to Sudbury now because the variant is taking over Sudbury. You just had to listen to Penny, the medical officer of health this morning, and she more or less said that. It's everywhere. It's everywhere. Now, we warned of this a number of weeks ago, Dr. Zalan and I, and the present mayor. I think council has to be called today by the media and the mayor and say, you people have to say immediately to the province, you have to get those vaccines up here. You sent them off to 13 health areas in the province. Not all of them even needed them. You have to do it for Sudbury because Sudbury is in the gray zone and Sudburyans are dying. And we're going to have a lot of trouble if they don't. That's my recommendation.
Good stuff. I just wanted to say, Jim, don't you think though, and it's funny, I'm smiling about it because I'm feeling this, and I think it's very common in the community, pandemic burnout. We just don't want to hear anything more about it. We almost don't want to believe in it anymore. We don't want to have anything to do with it. So we're going to go back to, in fact, there was, if, as everybody knows, a bit of a rally this weekend. And not that I didn't participate, and I don't think anyone participated, but there was a rally that said, stop this, get off the treadmill. But Peter and Jim and we've got to actually rally the troops again and bring this to a greater degree of awareness
Take it to the political people. We have a
Yes.
mayor, we have a council. We want them to step up now and tell the province, tell the premier, we can't wait any longer. We need these vials now. We, as the North, deserve it, and Thunder Bay does too.
And is Frangelina, I'm sure she is, Frangelina and Jamie West, they're knocking on the premier's door. The premier's holding far too many meetings. It's like, and the preparation, it's like at 9 o'clock in the morning or 7 in the morning, premier to give meeting announcement at 1 o'clock. And you think it's going to be something earth shattering for Sudbury, and it never is.
I should add also that I think it's up to individuals as well. I would urge them to all send letters to the premier's office. You know, hundreds and hundreds of letters can't hurt. You know, individuals should also, you know, speak out that this is truly is unfair and unreasonable.
Well, you know, you put an URL at the bottom of your paper, I believe. So what do? Tap on that URL and then send a email message to the premier? Is that what you're suggesting?
That's exactly.
Okay.
Is there a responsibility of our medical officer of health to deal with the province with respect to requests for the vaccines? Who determines how many vaccines are going where?
I'm sure she's been asking for them. I'm sure that she's been talking to them down south, but they're not listening to her, and that's wrong.
And we're getting very mixed messages. Peter, in just a moment, if you could answer how many ICU beds we have, how many we could have, because you can always do additional work. I understand it in the parking lot at one of the large hospitals in Toronto, they're setting up a military style hospital. And yet at the same time, they're saying, you know, things are getting better and you're going to be able to eat inside and outside. And you know, real mixed messages here.
Well, at the moment, we have enough ICU beds. Actually, the normal number of beds is 26. They've actually enabled the hospital to have quite a few more. And we've been still taking these extra patients from Thunder Bay. So the problem are the rising numbers, and is it going to keep on rising? And that's why, to be careful, they've started canceling elective surgery and
Yes.
cutting back on clinical on outpatient clinics. So because who knows? I mean, like with the gentleman who was on the radio this morning, who's into creating these models, and that's his job from McMaster University. He's the one that talked about that the problem is really the variant. You know, that's how we got into trouble. We're now up to 50% in variants. It could go up to 90% as in other jurisdictions. And more people are going to be in hospital and more people are going to get it. So if that's the case, we're in trouble. And really the only treatment at this point, since we have so many cases, is getting vaccinated as quickly as possible. And that's why I'm speaking out.
Very good.
How about
Peter,
the
I just want,
possibility of locking down a little more? Is it? I know I was reading in Maclean's talking about year number one and the failure of our political leaders to be more, I guess, robust in locking down, and like other countries did, and apparently have come out of it, you know, much more favorably than ourselves. Do we need to lock down more in the Sudbury and Thunder Bay area, in your opinion, Dr. Zalan?
Well, I think we're already in a lockdown. I've stopped arguing about that because there's actually two ways of dealing with COVID. It seems like, depending on the country. In case you have the one where you want to eliminate the virus altogether, such as New Zealand, and they've also done it in the Maritimes, where you want to go down to zero. Like one is too many cases. Then there's the opposite method, which is try to mitigate what's happening, which means in Ontario, opinion was that as long as we only had 1,000 cases, we'll just manage just fine. So that's why everything kind of opened up. And now, of course, we're up to as high as 1,700 or 1,800 per day and still increasing. So it may very well be that the entire province will go into another lockdown, you know. So we're kind of the in-between. In America, in certain areas, there were zero rules. That's the opposite. That's the total opposite of doing away with having zero. We're in between, you know. One day we want to get rid of it and we start having lockdowns. Then we open up and then we lock down. Then we open up, then we lock down. We're sort of in no man's land.
So what happened here in Sudbury? For months and months, we were dealing with just a handful of cases. Then all of a sudden it just ballooned right after the time, right after you wanted to put a bubble around Sudbury. Right after that, everything went haywire.
Yeah, well, problem number one was being open for Christmas, eh? Premier Ford thought he'd be kind about Christmas. So that gave us the first big outbreak. And then after that, we're just up the road from Barrie, right? So Barrie was the actually epicenter of the variant. And it now has actually 3 different kind of variants. Fortunately, most of them are the UK and not the South African or the Brazilian, at least not yet. And people just driving back and forth on the highway. It's not hard to figure out.
Peter, I have to ask, did you see this document at all? It actually is put out by Public Health Ontario.
Yes, and it gets updated every so often. Yep.
So this one was in January. Has there been an update?
Yeah,
And
there's one that's of March the 4th.
March the 4th. Okay, fantastic. Let me ask the next question then. Jim, you were and still are very much a thought leader here in Sudbury. You, Wendy Watson, many of these people have dealt with crises. Were you ever consulted in any of this to provide, you know, at least a couple of thoughts on how to go about dealing with this better?
No.
I know there is.
Why
not,
This
Jim?
is it's not unusual. This is the same the world over. When new people take over, they feel that they know what to do, and perhaps figured you didn't. so they don't bother talking to you. But I'll tell you, we have to get after the province now, because our public health people are working as hard as they can to slow things down, to get somewhere with this, but they have to be, it has to be seen that the public and the council and the mayor want it done. Okay? We have to do that. And they, I'm sure, will pick up the challenge and do it, because that's their job.
Well,
Sorry, I just wanted, sorry, I apologize. But you asked earlier how to get hold of the premier. Just on your computer, just type into Google, how do I contact Premier Ford? And he will tell you.
Very good. I just want to remind everybody that the 43rd Ontario general election will happen on or before the 2nd of June 2022. If that's of any news to anybody, any use to anybody. Well, anyways.
I hope I get vaccinated before then.
Well, this now there's the age thing now here in the Sudbury area, and I suppose Thunder Bay. It's only those over the age of 80. However, we keep hearing that in other jurisdictions it can be,
60.
70 to 75, 75 to 80, and I think we mentioned earlier on, sometimes in certain areas you're looking at 60 and over. Is that correct?
Right. We've got COVID MV.
Yes, you are totally correct. Here it's 80 and over because they haven't vaccinated all the 80-year-olds.
Mhm.
So the bottom line is we just don't have enough vaccine to do all our 80 plus people quickly. And they're still finishing vaccinating all the healthcare providers, that are at high risk. So as a consequence, they haven't gotten around to any 75-year-olds. So send us more vaccine and we'll do it. Now the 60 question is pharmacies who are actually allowed to use the AstraZeneca vaccine. Now there's people are wondering, should I get vaccinated? Actually, I've had my wife's sister emailed me to find out, should I take the AstraZeneca because she could go get it?
Mhm.
I would prefer getting the Pfizer. So I said, well, I'll do research on that as well. So I won't go into that right now because that's another question. But that's what's actually going on in the South, where you actually say, well, let me make a choice. Do I get this one or do I get that one? Now, we don't have any such choices. So even our pharmacies are not allowed to give it. Our family doctors are not allowed to give it. Like kind of weird up here. So that's what we have to truly object to, and everybody should object to it.
So what would it take to have our pharmacies and our family doctors being able to give the shots?
Well, first of all, they would need vaccine, and they should be allowed to do it because right now it's called pilot projects.
Mhm.
And then he who designated the pilot project pharmacies and the pilot project family doctors, that's also the province at central headquarters.
I can just imagine Jim Gordon saying, "I'm as mad as hell, and something's got to be done."
Not going to take it anymore.
No.
Exactly. You should all watch that movie from Network.
Yeah, right. Well, it does appear that we're
But
being.
who is running things? But
Yeah.
who is running things?
That's a good
Really?
question.
Do we know? Would somebody really step forward and say, I am the medical person who's running things? Certainly it's not Dr. Williams. We all know that. And it's not the general, because he threw away his opportunity to really be a leader. So who's calling the shots in this province, in actual fact? And that's why I think it's down to politics now. And that's why I'm saying to you, you have to get your local politicians to stand up and say, we want our people to be protected. We're the gray zone. We have the variant here. It's spreading. You've given extra vials to people who don't need it. So would you please reverse course? Because the North has been left out. That's the truth. That's
One
the
wonders
truth.
one wonders though, Jim and Peter, at the very end, I mean, 3-5 years from now, somebody will write a book. Somebody will do a complete, expose of everything that happened, that went wrong. And, you don't want to say, I told you so, because you want things fixed right now. But I wonder if this story that you're sharing right now is playing out in Northern Alberta, Northern Saskatchewan, Northern BC. Is it a Northern thing? Are we being forgotten because we're only 8% of the Ontario population with 92% of the land mass? Are we being forgotten?
Well, we know that's true. We've seen that in a variety of ways. Anything north of Steeles Avenue really doesn't exist. Okay, but when your people are losing their lives, when your people are having to stay home, when your businesses can't open, and it's all down to a lack of will on the part of the province to treat everybody equitably, then you have to get up and fight over it. Well, how long are we going to wait? Tomorrow? Maybe tomorrow? How about next weekend? How about a month from now? We'll finally get around to it. Are you? This doesn't make any sense. It's wrong. It's morally wrong.
It's almost, we talk about elder abuse, it's almost like Northern Ontario abuse. When it comes to,
Always has been.
Can I tell you a cute story?
yeah,
Sure.
This actually is funny, but it's to the point. And it comes way back from 1970s actually, because I grew up in Toronto, and when I went through medical school, I received some financial help while I went to medical school, and in return, work as in an underserviced area. So actually, I spent 5 years as family doctor in Geraldton, which is well north, and I grew to love Northern Ontario, and that's why, as an anesthesiologist, I came back to Sudbury, and I love it here. But I remember going back to for a visit to Toronto during that period while I was in Geraldton, and I was asked, actually, went to some kind of party, and I was asked, like, where are you working now? So I said, well, up north. And I said Geraldton, and of course, nobody's ever heard of Geraldton. So, and the lady asked me in return, is that north of Steeles Avenue? And I said, it certainly is about 750 miles. We had miles in those days.
well, we all have our Northern Ontario stories, but we only have about 3 minutes left. So maybe we should wrap up by going around the table here, as it were, and getting our final comments in. We'll start with Hugh.
Okay, I'm going to probably do what Peter's going to do is, if you're mad as hell and you can't take it anymore, and that's the Jim thing, you should write to Jamie West, to Frangelina, and let them have that, to copy them, send it to the Premier, send it to whoever you think, Dr. Williams, anybody who you think might have an ear. If the volume is there, they will pay attention.
Mr. Gordon?
Well, I think we've got a wonderful doctor here who decided to come north and is a true northerner. And if anybody is going to wake those people up down south on our behalf, it's going to be Dr. Zalan. He's been writing, he's been talking, he's here today, but they have to listen. We have somebody who should be the medical officer of health for Ontario right here. So let's show him that we're going to support him, and we're going to send the emails, we're going to pick up the phone, we're going to talk to our mayor, to our councillors, and of course to our MPPs and MPs, and say, look, the time has come. Sudbury is in trouble, real trouble.
And Dr. Zalan, your final words here.
Well, I think you guys put it very well. And all I can say is, start typing and phoning.
Let's get it done. Well, thank you very much, all. And if this recording works out, we'll be sending that out as well, too. So thank you very much. Yep. COVID Sudbury. We're in a crisis zone as well as Thunder Bay, and we need that help. Stand it up right away.
Excellent. Thank you, John.
Bye for now.
Thank you for all the good work you do.
Peter. John.
Hi, guys.
See you. Till next time.
Bye, Dr. Zalan. Thank you very much.